The Black experience in America is inextricably interwoven with a legacy of systemic racism and discrimination. This legacy continues to cast a long shadow, profoundly impacting various facets of life for Black communities. From health outcomes to economic opportunities and mental well-being, disparities persist. This essay aims to shed light on these enduring challenges, exploring the complexities of health disparities, mental health issues, and economic barriers faced by Black Americans. Section 2. The weight of health disparities. Health disparities, the stark differences in health outcomes and access to health care across racial lines, are a pressing concern for Black communities. These disparities manifest in various ways, from higher rates of chronic illnesses to limited access to quality healthcare services. The impact is profound and far-reaching, affecting not just individuals but entire communities. Statistics paint a troubling picture. They reveal the extent of the problem and highlight the urgent need for action. Numbers alone, however, cannot fully capture the human suffering and the loss of potential that these disparities cause. For example, Black adults face a disproportionately higher risk of chronic diseases such as obesity and diabetes. These conditions are not just health issues, they are also social and economic burdens that can limit opportunities and reduce quality of life. According to the Centers for Disease Control and Prevention, in 2023, nearly 50% of Black adults were obese, compared to about 41% of white adults. This significant difference underscores the need for targeted interventions and support systems to address the unique challenges faced by Black communities. Similarly, the diabetes rate among Black adults was a staggering 19%, significantly higher than the 12% rate among white adults. This disparity in diabetes prevalence is a clear indicator of the systemic issues that contribute to unequal health outcomes. These disparities are not random. They stem from a complex interplay of social, economic, and environmental factors, all rooted in systemic racism. Factors such as limited access to nutritious food, safe neighborhoods, and quality education all play a role. Addressing these issues requires a comprehensive approach that includes policy changes, community engagement, and sustained efforts to dismantle the structures of inequality. Section 3. The unseen struggle: mental health in Black communities. Mental health is an integral part of overall well-being, yet it remains a stigmatized and often overlooked issue, particularly within Black communities. Despite the growing awareness of mental health issues globally, Black communities continue to face unique challenges that exacerbate their mental health struggles. Black Americans encounter unique stressors that can significantly impact their mental health. These stressors include the daily experiences of microaggressions, economic disparities, and the historical trauma that has been passed down through generations. Systemic racism, with its insidious tendrils reaching into every aspect of life, from education and employment to housing and healthcare, takes a heavy toll. The constant battle against these systemic barriers can lead to chronic stress, which is a significant risk factor for mental health disorders. Discrimination, both overt and subtle, contributes to feelings of isolation, anxiety, and worthlessness. The impact of these experiences is profound, often leading to a sense of hopelessness and helplessness that can be difficult to overcome without proper support. Studies have shown that Black individuals experience higher levels of psychological distress compared to their white counterparts. This disparity highlights the urgent need for culturally competent mental health services that can address the specific needs of Black communities. By fostering open conversations and providing accessible resources, we can begin to break down the barriers that prevent many from seeking the help they need. Section 4. Economic adversity: a barrier to well-being. Economic inequality is a persistent reality for many Black Americans, and its impact on mental health is undeniable. The historical and ongoing discrimination in areas such as housing, education, and employment has resulted in a significant wealth gap between Black and white Americans. This economic disadvantage translates into limited access to quality healthcare, including mental health services. The stress of financial instability, unemployment, or underemployment can exacerbate existing mental health conditions and create new ones. Section 5. The hurdle of access: barriers to mental health services. Seeking and receiving adequate mental health care can be challenging for anyone, regardless of their background or circumstances. However, for Black Americans, these challenges are often magnified by a unique set of barriers that can make accessing mental health services particularly difficult. One of the most significant barriers is the stigma surrounding mental illness within the Black community. This stigma can be so pervasive that it prevents individuals from even considering seeking help, let alone actually reaching out to a mental health professional. The fear of judgment, shame, and being labeled as crazy or weak can be overwhelming. This fear is often rooted in a long history of mistrust and misunderstanding about mental health issues within the community. Additionally, there is a significant lack of culturally competent mental health professionals who can provide care that is sensitive to the unique experiences and perspectives of Black Americans. This lack of representation can make it difficult for individuals to find providers who truly understand their cultural background and the specific challenges they face. Without this cultural competence, mental health care can feel impersonal and ineffective, further discouraging individuals from seeking the help they need. It's crucial to address these barriers to ensure that everyone has access to the mental health care they deserve. By increasing awareness, reducing stigma, and promoting the importance of culturally competent care, we can begin to break down these barriers and create a more inclusive and supportive mental health care system for all. Section 6. Community as lifeline support systems in Black communities. Amidst these challenges, Black communities have historically demonstrated resilience and a profound capacity for support. Churches and faith-based organizations often serve as pillars of strength, providing spiritual guidance, social connections, and a sense of belonging. Community leaders, mentors, and elders play vital roles in offering support, guidance, and wisdom. Recognizing the power of collective action, many grassroots organizations have emerged, led by and for Black individuals, to address the mental health needs of their communities. Section 7. Striving for equity initiatives and the path forward. Addressing the multifaceted challenges faced by Black communities in America requires a multi-pronged approach. Policy changes are crucial to dismantle systemic racism and create equitable opportunities in education, employment, housing, and healthcare. Increasing access to affordable, quality mental health services is essential. This includes expanding insurance coverage, recruiting and training more Black mental health professionals, and reducing the stigma associated with seeking help.